More and more young women dying from heart disease, 6 times more than breast cancer. Our guest tells us why this hour in the newsroom. It's taking a deadly toll on young women. Heart disease. A new study shows a troubling turn for women under the age of 45. Sounding the alarm, Dr. Nisa Goldberg. She's the author of Women's Healthy Heart Program. Her upcoming book, Dr. Nisa Goldberg's Complete Guide to Women's Health. She is also medical director of the New York University School of Medicine's Women's Heart Program. Dr. Goldberg is in New York with us this morning. Well, you are certainly the person to talk to about this study. In fact, if you wouldn't mind, Doctor, could you sort of break it down for us a little bit about the main findings here?
The main findings of the recent study shows that the death rates due to heart disease have decreased in both men and women, but there was an alarming statistic that more women under the age of 45 are having heart attacks. That is because there is a big gap in women's awareness on heart disease risk.
So you think that's the main reason then? People just don't seem to understand that it's not breast cancer, it's not ovarian cancer possibly. I'm just thinking of a lot of things that women are concerned with. It's heart disease.
Well, a survey done by the American Heart Association last year showed that women under the age of 45 were more likely to think of breast cancer as their greatest health threat. Unfortunately, it's heart disease, and we really need to raise women's awareness. And what was even more disturbing about the recent study is the fact that more young women have obesity, diabetes, and high blood pressure. Also, other important risk factors for young women are smoking, family history, and lack of exercise.
Wow, that's an awful lot of factors to be looking at. It also seems like women have some different symptoms than men. What's so different between the sexes?
Well, when I went to medical school, I was told that a heart attack was going to be a 165-pound businessman clutching his chest.
Yeah.
But in particular, especially in young women, they may not have chest discomfort at all. They may have shortness of breath and unusual fatigue. Some women get the pressure lower down in their chest. Oftentimes, they go to the doctor and they're told that they're having a panic attack, but in fact, they may well have heart disease.
Wow. Why is it then that we just don't hear very much about women and heart disease?
For a long time, the medical community thought that heart disease was a disease of men and older women. And it wasn't until the past 10 or 15 years that we found that more women were dying of heart disease, and research efforts are being focused. But I still think that we need more research on why these young women are dying of heart attacks, and also that doctors need to be very aggressive in counseling young women about their risk factors. For instance, most women don't realize that you should have your first cholesterol test when you're in your 20s, so you could know where you stand on the spectrum of heart disease risk. And although Thanksgiving is a rather challenging holiday to eat a healthy diet, I mean, some important tips are actually when you eat the turkey to take the skin off so you can reduce the fat in your diet, and cranberries are very rich in heart-healthy antioxidants. You know, if you want to have a little stuffing, then you pass up the rolls, because it's very important for everyone to reduce their intake of sugars and starches and really to eat fruits, vegetables, whole grains, and decrease their saturated fat.
Yeah, and it's so hard to do on Thanksgiving, but really some good advice there. Quickly, before we let you go, you say 10 to 15 years that we have known now that women are really at risk for heart disease. What needs to be done? What is the number one thing that needs to be done by way of raising awareness here?
Well, the number one thing that has to be done is that when women go to the doctor, every single woman, no matter what her age, has to be screened for heart disease risk factors when she goes to the doctor. And if your doctor doesn't tell you what your heart disease risk factors are, you ask. So at the very least, you should be getting your blood pressure, your cholesterol, and your sugar checked to make sure you're not diabetic.
All right, excellent. We appreciate your being with us today and drawing some more attention to this. Dr. Nisa Goldberg, again, thank you, and happy Thanksgiving to you.
Happy Thanksgiving.